Plagiocephaly, otherwise known as flathead syndrome. Basically, it's an asymmetry of the head of a baby. Typically, you'll start to notice it when baby's on their tummy or when you're washing their head. You might notice that one area might be a little softer, might be a little flatter, and might be sticking out a little bit more. We also see brachiocephaly, which is when the occiput, the bone right here, ends up being really flat, and the baby looks like he has a big head. This is an adult model. This is not what an infant looks like. Newborns, their cranial bones are floating, and they're not all attached yet. So plagiocephaly is becoming quite common. There's a multitude of reasons for this. It could be baby has a side preference, the baby has a torticollis, so twisted neck, and remember that they're small and compact, but even in adults I've seen this. Torticollis is rarely just in the neck, the whole body is connected fascially with the soft tissue. It can be from interventions during birth. Sometimes nerves can be compressed during labor, and so some of the cranial nerves that innervate the neck might not be firing as efficiently. It could be also from the baby being stuck in the womb a little bit, not having enough space to move around. A lot of moms work at desks now, and if you're sitting during gestation, your baby's not getting to move as much as the baby would have if you had been moving around. So very common. What's important to know is that it's reversible and you can help your baby recover. Definitely recommend working with a professional. You can seek out gentle therapy with a craniosacral therapist, osteopath. There are OTs, PTs. And in some cases you might need to use a helmet during the process. And even if you do use a helmet for the correction, which is completely normal, I've worked with babies who have done that, I still really recommend that you get the body work for your baby, because you want to resolve what caused the tendency to always lay on that spot on their head. Otherwise, it's going to slow down the process and they might still have issues down the road. What we've seen with plagiocephaly is down the road, much further down the road, you're going to see potentially scoliosis, TMJ dysfunction, sensory processing difficulties. Earlier in the road, you might see oculomotor discrepancies in the development. So it's important to have it resolved. And there are things that you can do also at home to help your baby strengthen their neck, enjoy tummy time, which will relieve the pressure on their head. So we're seeing, because babies spend so much time on their back, an increase of plagiocephaly and brachiocephaly as well. So, making sure that you change how you hold your baby. So holding your baby is important, carrying your baby, and then also when you're breastfeeding or if you're bottle feeding, making sure that you change the side that you hold your baby on. Of course, they might have a preference, and that is a sign that they might need some body work. So many little things you can do. Be attentive to your child, be kind and caring, be gentle on yourself too. This is super normal, and there's a lot of us out here that are willing to help you and prepared to help you. So I hope you find this useful and informative. If you have any questions or comments, please leave them down below. I really want to help you and your baby feel your best and thrive in this beautiful world that we get to live in. Thank you so much and have a great day.